Today we will be discussing about Erbs palsy. So first, what is Erbs point? Erbs point is a point on the upper trunk of brachial plexus. We'll draw the upper trunk of brachial plexus. So this is the ventral rami of C5 spinal nerve, and this is the ventral rami of C6 spinal nerve. The ventral rami of C5 and C6 spinal nerve combine to form the upper trunk of brachial plexus. So this is the upper trunk of brachial plexus. So we know that the upper trunk further divides into an anterior division and a posterior division. So anterior division, this is a posterior division. So this point in the upper trunk is known as Erbs point. We know that from the upper trunk of brachial plexus, two nerves arises. These are the suprascapular nerve and this is the nerve to subclavius. So at Erbs point, 6 nerves converges. What are the 6 nerves? So the ventral rami of C5, the ventral rami of C6, then the suprascapular nerve and nerve to subclavius, then the anterior division of the upper trunk, then the posterior division of upper trunk. These are the 6 nerves converging at the Erbs point on the upper trunk of brachial plexus. Then what is Erbs palsy? So Erbs palsy is a clinical condition which occurs when there is an injury to the Erbs point of the brachial plexus. So now that the C5 and C6 combine together to form the upper trunk, divides into anterior division, posterior division. There is a suprascapular nerve and nerve to the subclavius. So which are the nerves affected? The nerves affected includes the musculocutaneous nerve, the radial nerve, axillary nerve, and the suprascapular nerve, which is a branch of upper trunk of brachial plexus. As the musculocutaneous nerve is affected, muscles supplied by the musculocutaneous nerve like brachialis and biceps are affected, and some muscles supplied by the radial nerve like brachioradialis and supinator is affected, and muscles supplied by the axillary nerve, that is deltoid and teres minor, is affected. As the suprascapular nerve is injured, muscles like supraspinatus and infraspinatus if affected. So these are the nerves affected, and muscles supplied by the nerves are also paralyzed. So Erbs palsy is a clinical condition which commonly occurs when there is an undue separation of head and shoulder. So when there is an undue separation of the head from the shoulder, this commonly occurs during delivery with forceps and all. So it is also called obstetrics palsy. Can also occur due to a fall on shoulder, and during anesthesia also. Now we have to understand the position of the upper limb in Erbs palsy. For that we should know the movements affected, the muscles affected. So there is a mnemonic for the muscles which are affected in the Erbs palsy. That is, three brothers sits with deltoid. So the three brothers means three muscles starting with the letter B. These are biceps, brachialis, and brachioradialis. And six includes supraspinatus, I stands for infraspinatus, teres minor, and supinator. And the important muscle is deltoid. So now that biceps causes flexion of the forearm and supination of forearm. brachialis and brachioradialis. It causes flexion of forearm. Supraspinatus, it causes abduction of arm. Infraspinatus causes lateral rotation of arm. Infraspinatus along with the teres minor causes lateral rotation of arm. And supinator causes supination of forearm. So deltoid is the chief muscle of abduction of arm. So all these movements are affected because of paralysis of these muscles. Flexion of forearm and supination of forearm is affected. Abduction of arm is affected. Lateral rotation of arm is affected. So paralysis of deltoid and supraspinatus results in loss of abduction of arm. Paralysis of infraspinatus and teres minor causes loss of lateral rotation of arm. So the loss of abduction of arm along with the loss of lateral rotation of arm causes arm to be in adducted and medially rotated position because of overaction of the adductors of the arm and the medial rotators of the arm. Because the abductors and lateral rotators of the arm are paralyzed, it results in position of arm being in adducted and medially rotated. And because of as the nerves apply to the brachialis, brachioradialis, and biceps is gone, it results in loss of flexion of forearm. And paralysis of biceps and supinator causes loss of supination of forearm. So the loss of flexion of forearm along with the loss of supination of forearm causes overaction of extensors forearm and the pronators of forearm. So the loss of flexion along with the loss of supination results the forearm to be in an extended and pronated position. So the forearm is extended and pronated. And pronated forearm. So the characteristic position in Erbs palsy is adducted and medially rotated arm and extended and pronated forearm. So this characteristic position is known as policeman's tip's hand, policeman's tip's hand, or waiter's tip, or porter's tips position. So that's all about Erbs palsy. To see more videos on our channel, please subscribe our channel. Thank you.